you want to be healthier, yet you just don't know what to do? All these shows telling you this and that, but nothing seems to work. Well, listen close. Golden State Media Concepts has got something great for you. The Health and Wellness Podcast dedicated to workout trends, healthy eating habits, diet, and everything about healthy living. Join us in our banters as we help you not just live life to the fullest, but live it to the healthiest.
Tuning in to the GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'm your host, Alex. This week, I asked the kids what they would be interested in learning more about, and they chose constipation. So the kids just randomly asked me too, Alex, what causes constipation? And I was like, you know what? I'm really not sure, aside from not drinking enough water or getting enough fiber. So I decided to dig into it. Constipation is something we don't talk about a lot as adults unless we're referring to it in relation to our kids, but it is something that a lot of us experience. Let's face it, we are all humans, and as the children's book says, everybody poops. So this week we're going to dive in to kind of a taboo subject, and that's going to be constipation. First up, we are going to talk about what constipation technically is and how bowel movements are produced. Then we're going to discuss some of the symptoms, side effects, and causes. Stick around to the end when we talk about both natural and medical approaches to overcoming constipation. So first up, how are bowel movements naturally produced? Well, when you have a bowel movement, that is the indigestible parts of our food leaving our body, the waste. So we have absorbed as much of the nutrients as possible during its journey through the GI tract. We've absorbed most of the water as well. Those microvilli in the intestines have also tried to absorb as much of that that's left over, and that helps condense all of your leftover pieces of food down into waste that we recognize as excrement. So, you have a couple different parts of the GI tract that control your bowel movements. And that is going to be the rectum, the anal canal, the sphincters, those little circular muscles, and also hemorrhoids. And these are all embedded in the muscles of your pelvic floor. So this is way down there at the bottom. So in your rectum and anal canal area, you have your rectum that's about 20 centimeters long, and it's that last section of your intestines. So this is your large intestine. After your stomach, everything goes through your small intestine first and then through your large intestine. So this is the very end of the large intestine, and it's called the rectum. So that is where all of those indigestible bits of our food collect until our bowel is empty. The anal canal is that little stretch that goes between the rectum and the anus, and it's closed off by your sphincter muscles and hemorrhoids. It just makes sure that it stays closed, and then when you need to release your bowel movement, then those sphincter muscles will stretch back out. The anal canal itself is way smaller than the rectum, so the rectum, 20 centimeters long, and the anal canal is only about 3 to 6 centimeters long, and it has a lining that has a mucous membrane. Now that might sound gross, but You have mucous membrane linings in a lot of your body. That includes your mouth, your nose, your windpipe, your eyelids, your lungs, stomach, intestines, of course, and also parts of your urinary tract, like your ureters, your urethra, and your urinary bladder. So I know a lot of us hear the word mucus and we're like, ugh, mucus, gross. But it's not actually all that weird. Just think about like the inside of your mouth or your nose or your eyelids. That's what they're talking about when they say mucous membrane. So you have that lining in there, and that mucosal membrane lining is really important because it has a lot of nerves that help send signals to your brain to tell it things like what the consistency of your stool is and how full your bowel is. Is it time to go? Those nerves are helping to report back to your brain about when you need to go to the bathroom. Now, after the anal canal, you have those anal sphincters we mentioned earlier. And there's two of them. You have the inner or internal anal sphincter, and then you have the outer or external sphincter, and that's at the end of the anal canal. The inner sphincter is responsible for making sure that your rectum doesn't open while you're sleeping. You want to make sure it's not opening randomly. And it's just a little ring-like shape that's made up of smooth muscle. So the outer sphincter, on the other hand, helps out the inner sphincter by giving it some support in performing its function. The outer sphincter is the one that you can control voluntarily. The inner sphincter, you can't. So it's like breathing. That's something that you do even while you're asleep, and you can't consciously always control it. Or rather, you can consciously control your breathing, but you can't just decide to totally shut it off. It's something that's going to happen whether you are sleeping or awake, etc. Whereas the outer sphincter, that's the one that you can just go ahead and stop. It's like, I don't want to go to the bathroom right now. I don't want to go out in the woods, or, I am driving home. I'm stuck in traffic. Now is not the time, bowels. And then you use your outer sphincter to make sure you're good to go, that you are not releasing anything right then. But it makes it possible to empty your bowels or to prevent going to the bathroom whenever you need to. But that outer sphincter can also be involuntary in nature, much like your lungs. So you can hold your breath, and they can also operate independently of you. And by you, I mean your consciousness or your conscious control. Now, hemorrhoids, I know that we said that earlier, that the hemorrhoids also help you with preventing that stool from leaving the body. And it's like, hey, wait a minute. I thought hemorrhoids were a bad thing that, our grandparents and everybody growing up would treat with witch hazel or hemorrhoid ointment. It's that cream that they use in Miss Congeniality in order to make sure that, I think it was keep her bathing, no, the hairspray was to keep her bathing suit from riding up, right? I don't remember what the hemorrhoid ointment was. Oh, it was for under her eyes, right? So it was to help relieve the dark circles under her eyes. So we think of hemorrhoids as being something that you have to treat and that there are medications and natural remedies for. But in actuality, hemorrhoids aren't necessarily all bad. It's just when they're enlarged that they cause a problem. So hemorrhoids in and of themselves are actually like these little pillows, these little cushions of tissue that are filled with blood vessels. And they're at the end of the rectum, just inside the anus. So these cushions, together with the anal sphincters, help keep the bowel closed off. They actually are good for you because they help prevent the stool from leaving your body when you don't want it to. Now, when they get enlarged, though, that's when they can cause some problems. So if somebody's talking about having piles or having hemorrhoids and they're saying, oh no, I have hemorrhoids, then that's what they mean, is their hemorrhoids have actually enlarged and they're causing a problem. But when they're not inflamed, then they're totally fine, and they actually help prevent stool from leaving your body when you don't want it to. I know you probably didn't think you were signing up to hear that hemorrhoids aren't really the bad guys today, but sometimes science is just weird. Now, after that, you have the pelvic floor helping out with your bowel movements. And you may be familiar with the pelvic floor from conversations about Kegels and stuff. And that pelvic floor is made up of muscles, ligaments, and connective tissue. So it's there to physically support your pelvic organs, to keep everything where it needs to be, and to close off the lower part of your pelvic cavity. But there are little holes, essentially, in this tissue that allow your rectum, urethra, and vagina, if you have a vagina, to pass through. So the pelvic floor also relaxes when you have a bowel movement, and it contracts or squeezes when you decide to not go to the bathroom. If you're holding that stool back, then your pelvic floor is going to contract at that time. So that leads us to what gives you the urge to go. Well, when your rectum fills up, there are stretch receptors that are in the wall of your anus, and those get activated. So they're there to go, hey, what is our capacity for stretching? How much content can we hold? When is it time to evacuate? This is our threshold for stretching. This is our threshold for the capacity. So, hey, let's send that signal along those nerves to your brain, which is in the cerebrum, specifically the part that they're sending the signals to. And once they're there, they are processed and the signals are sent back to that lining of your anus. And then those nerve impulses have the inner sphincter open, and that is that sensation that tells you you need to empty your bowels. Remember that inner sphincter is the one that is involuntary. It's what keeps it closed off while you're sleeping, much like how your lungs continue to work even while you're sleeping and you're still able to breathe. Once those nerve impulses reach that area and you feel like you need to empty your bowels, then your pelvic floor relaxes and effectively drops down a little bit, and that enables your muscles in your rectum to push the stool out of your body. So if you are in the vicinity of a restroom and you're like, okay, let's do this, bowels, and you listen to that urge and you go to the toilet, then you voluntarily relax your outer sphincter muscle and go to the restroom. You evacuate your bowels. But you can also hold back your stool for quite some time by tensing those muscles back in your pelvic floor and your abdomen. And that is also related to tightening your outer anal sphincter, the voluntary one. So where that pelvic floor was relaxed and dropped down a little bit, you are intentionally tightening it up and lifting it up so that it's contracting those muscles in the area and preventing you from going to the bathroom. But after a bowel movement, your inner sphincter closes off again, and that makes you feel like you no longer have the urge to go to the bathroom. Overall, I think it's pretty fascinating how our body works with itself, all of these different parts, these different organ systems, to really just interact and go, hey, all right, it's time to go. Everything is regulated. It's not on a timer, but it is on like pressure valves, essentially, like those stretch receptors and all of these different triggers in your body that kind of flip these switches and go, if this, then that. I think it's pretty metal. The human body is pretty fascinating, and I am glad to have you guys on this voyage with me today. I know it's not the magic school bus, but we're going to learn a lot about our personal health and wellness. We're going to go on a quick break, and when we come back, we are going to talk specifically about constipation. Stay tuned.
Are you looking to learn more about the latest trends from the fitness world? Are you confused by all of the different trends that are out there? The GSMC Fitness Podcast is the place for you. The GSMC Fitness Podcast is the place to come for people of all skill and interest levels. Join us as we explore the latest trends in the fitness world. Does that new exercise really work? Should I try yoga? Whatever your question, chances are good you'll find an answer on the GSMC Fitness Podcast.
Welcome back. Before the break, we were talking about how bowel movements work. Now we are going to use that information to discuss constipation specifically. So we know what's supposed to happen, but with constipation, sometimes it just doesn't go that way. And you get constipation when your bowel movements are less frequent than they were before, and your stool often becomes difficult to pass. So that happens a lot due to changes in not just your diet, but also in your routine. And it can also be due to not getting enough fiber in your diet. So before the kids asked me that question this week, I did not know anything beyond that, which is just the first line on any page that you go to about constipation. But what is normal for bowel movements? What does it mean going less frequently than normal? Have I been constipated my whole life and I just don't know because I don't know what a number of bowel movements is normal for everybody else? These may be questions that you've been asking yourself. So we're going to talk about it because people normally don't talk about it. And because of that, no one really has a baseline for what's normal for their bodies. So what specifically is constipation? Technically, medically, if you have fewer than 3 bowel movements per week, then you are constipated. So each week, you should have at least 3 bowel movements. Anything less than that means you're constipated. So if you only have 3, then you're golden. If you have a little bit more than that, you're still good. As long as they're solid and not funny shapes, colors, or textures, then you are good to go. And we'll talk about that more in the future. But for right now, do keep in mind that this is just the baseline. A lot of people have a wide variation between how frequently they have bowel movements. Some folks have to go several times a day. Other folks only have them once or 2 times a week. And whatever your bowel movement pattern is, that's likely very unique and normal for you, as long as your pattern isn't straying a lot and you have a pretty good diet and exercise regimen. Otherwise, you might be having bowel movements that are consistent with constipation for years and perhaps just aren't aware of it because of the diet and the exercise. That could just be coming across as your normal, when if you upped your fiber and water intake, it could actually be closer to that 3 or more per week. So we just want to be totally attentive and view this, like we do all things, holistically. But whatever your bowel movement pattern is, as long as you're not straying too far off of it and you're being attentive and holistic, then it's okay. All of us are unique, and if you go 4 times per day versus 3 times per week, that can still be normal. You do need to know, though, that the longer you go in between bowel movements, the more difficult it can become for the stool to pass. So there are a few key features that typically are associated with constipation, and that is dry and hard stool. So that first one, dry and hard stool, is because the longer it's in there, remember, you have those little intestinal microvilli that are there to absorb nutrients and water and everything else from your waste. So the longer it's in there, the more work those microvilli are going to be doing. And although you do want it to get a good amount of water from you, you don't want it to come out dry and hard. That makes it a lot more difficult to pass. And then that can lead to the next key feature of constipation, which is a painful bowel movement where you're having difficulty passing your stool. You also might have a feeling like you've not fully emptied your bowels. So those are all 3, those main key features. And if you're feeling like that frequently, then you may well be constipated. And we'll talk in our last segment about some ways to fix that, including some natural remedies that won't cost you the price of having to go see a doctor. So how common is this? Well, you're not alone. Don't worry about it. Constipation, turns out, is one of the most frequent GI complaints in the U.S. There are at least 2.5 million people per year who go to see their doctor for constipation. And people of any age can get constipation occasionally. There are also certain people or certain situations that make you more likely to have chronic constipation. And that includes being older, because older people, just in general, tend to be less active. Your metabolism slows as you get older, and you have less strength in your muscle contractions along your digestive tract. If you're a woman, that can also make you more likely to have chronic constipation, especially while you're pregnant and after childbirth. All of those wacky changes in your hormones during those times make you more prone to constipation. And also, it doesn't help that you got a baby in there squishing on your intestines and thereby slowing the passage of excrement from your body. If you don't eat enough high-fiber foods, then you could be more likely to be chronically constipated. There are also certain medications that can cause it, and having certain neurological and digestive disorders can do it. So how does constipation come about? Well, it generally happens because your colon has absorbed too much water from your waste, and then it dries it out, and that makes it hard and difficult to push out of the body. The softer it is, the easier it's going to be to push out. I want you to think about trying to push water through a syringe, right? You're going to push your water through a syringe and it goes through pretty easily, right? If you go to plunge, say, Play-Doh through a syringe, it's going to be a little bit more difficult. You're going to have some more resistance to it because it's more viscous, but you're still going to be able to do it fairly easily. However, if you go and you put like some pieces of steak in there or something, then it's going to be like, what is this? This is very hard. You put beef jerky in it, I guess is a better example. How are you going to push beef jerky through a syringe, even if you have molded it to fit the shape of the syringe, which is effectively what your intestines do in that process of peristalsis. And peristalsis is that involuntary constriction and relaxation of your muscles, especially those in your intestines, and that creates those kind of wave-like movements that push the contents of your intestines forward, down through the large intestine to the rectum and the anal canal area to let you know that you need to go. That is also why solid stool tends to come out in that tube shape, because those muscles contract radially and symmetrically. So it's surrounding it and just pushing it through kind of in the same sort of machination that you would see if you are milking a cow. So it's these motions that go through in waves but are concentric, so it's all the way around and it's just slowly pushing it through down the tube. And interestingly enough, that's actually why wombats have square poop. I don't know if you guys know that about wombats, but they do. And I Googled why one day because I wanted to know why. And so it turns out that they don't have square anal orifices or square intestines. It's the way that their intestines push out their excrement. So in humans, we have that radial symmetrical contraction that pushes it along like in a tube, but it doesn't do it the same way in wombats. So while our intestines are elastic all the way around, the elasticity in the final 8% of the walls of a wombat's intestines are varied. And so that means that it's able to stretch more on one side than the other as it's pushing it through, and that causes the poop to take the shape of cubes, especially since wombats have to absorb a lot of the moisture from their diets. So in zoos where they have more access to water, then their stool often comes out as being less cube-shaped. But in the Australian wild, then the wombats are not having necessarily ready access to a lot of water. And so the drier it is, the easier it is for it to maintain that cube shape. So scientists figured this out by taking some wombat intestines that were recovered from roadkill. No animals were killed for that. And then they compared it to pig intestines by putting a balloon into that digestive tract to see how it stretched to fit the balloon. And in the wombats, that final 8% of the intestinal tract was causing that square shape, or that cube shape rather. So I thought that was pretty cool. And they're also thinking about how that method could be applied to manufacturing processes. So how you could create a cube with soft tissues and just make things come out a lot easier instead of trying to individually mold all of it. It sounds like some type of strange Dr. Seuss factory, but it very well could be the future, and it would have all been made possible by wombat intestines. I think it's pretty fascinating. Inspiration comes from all kinds of places. They're looking at ways to make planes more aerodynamic through studying the dermal denticles, the skin makeup of sharks right now too. So who knows where these wombat intestines are going to take us. But back to constipation. So wombat poop, normal for it to be dry, but also more square. For us, we need it to have more moisture still, and so the longer we wait in between going to the bathroom, the more water is absorbed from it, and too much water can be absorbed from it. And then that dries it out, and that makes it hard and difficult to push out, like trying to put those different things through a syringe. So it could be from sitting too long in between times. It can also be your food moving way too slowly through your GI tract, and that gives your colon too much time to absorb that water from the waste. Now, what might cause that specifically? Well, that can be lifestyle choices, medications, pregnancy, medical conditions, you name it. But some of the most common lifestyle causes of it include eating foods that are low in fiber, or being dehydrated, not getting enough exercise, or having a lot of changes in your regular routine. Like if you're traveling more than normal, or you are eating at different hours, or going to bed at different times. Your sleep schedule can also impact your constipation. If you eat large amounts of milk or cheese, that can also cause constipation. You can also be really stressed, and that'll do it. And if you are fighting the urge to have a bowel movement, if you're delaying it excessively, that can do it. On the one hand, though, I will say that with the cheese, I am a first-hand example that you can eat plenty of cheese. Eat cheese to your heart's content, and it might not necessarily cause bowel obstructions for you or constipation for you. I love cheese, and I eat it like every day. I have a Cheese of the Month subscription, and they send me 4 full-size cheeses every month, and they're delicious. Remember, all of our bodies are different. If you can't process milk or cheese, don't worry. That's okay. They have other melty cheeses that are made from non-lactose materials. Like, I think my vegan friend said the Daiya brand cheese is really good for being melty. So it's hard to get vegan cheeses to melt appropriately. But they say that that one melts really good. And it's one of the primary ones that they use on pizzas and stuff, for vegan pizzas. So there are alternatives out there, you guys, if you're a fellow cheese lover and you're looking for something that's not going to cause you constipation, or if you're lactose intolerant, a cheese that you can eat in your day-to-day life. There are also medications that can cause constipation, like a lot of strong pain meds like codeine or OxyContin, things like that. Some NSAIDs can do it too, like ibuprofen or naproxen. Some antidepressants do it too, especially SSRIs, like Prozac, or different types of antidepressants, like the tricyclic kind, like amitriptyline. You can also get constipation from antacids. If you take a lot of antacids, especially those that have calcium or aluminum in them, like Tums, then that can lead to constipation. So can iron pills, allergy medications like antihistamines, including Benadryl, and then certain blood pressure medications, especially if they have calcium channel blockers. So you see a theme here. Things that prevent the absorption of calcium can lead to it, or getting Too much calcium can lead to it. You can also get it from psychiatric meds like clozapine or seizure medication like gabapentin, or even anti-nausea meds like ondansetron. So there's a bunch of different drugs that can cause constipation. If you think that yours might be causing that, talk to your doctor or your pharmacist. The pharmacist, you can just walk up to the counter and ask them about it, and they're not going to charge you for it like doctors will. So you can just walk up and talk to them. Also, if you have an online portal, a lot of times nowadays, you can just shoot your doctor a message on there and they'll get back to you within a day or two and go ahead and answer that question for you without you getting charged. At least my doctor does that in Texas. In addition to these issues, also health conditions can cause constipation, like having an underactive thyroid gland, hypothyroidism, or other endocrine problems like diabetes, colorectal cancer, IBS, diverticular disease, neurologic disorders, lazy bowel syndrome. That's just where your colon doesn't contract properly and it just keeps your stool instead of pushing it forward like it should. Pregnancy and organ diseases like lupus. There are a ton of different health causes as well, so definitely talk to your doctor about it if you feel like you may have chronic constipation, or if you have one of these health conditions and also are experiencing constipation. They might be able to swap you to a different treatment plan or find another alternative for you. We're going to go on a quick break, and when we come back, we're going to talk about some of the symptoms of constipation and when to go see a doctor and what to expect when you do. Stay tuned.
Tired of searching the vast jungle of podcasts? Now listen close and hear this out. There's a podcast network that covers just about everything that you've been searching. Hey! The Golden State Media Concepts Podcast Network is here. Nothing less than a podcast bliss with endless hours of podcast coverage. From news, sports, music, fashion, cooking, entertainment, fantasy, football, and so much more. So stop lurking around and go straight out to the Golden State Media Concepts Podcast Network. Guaranteed to fill that podcast itch. Whatever it may be. Visit us at www.gsmcpodcast.com. Follow us on Facebook and Twitter, and download us on iTunes, SoundCloud, and Google Play.
Welcome back. Before the break, we were talking about some of the causes of constipation, including health issues, medicines that we may be on, and lifestyle choices. Now we're going to talk about some of the symptoms of constipation and what a visit to the doctor might look like if you should need to go. We're also going to talk about how to tell if you need to go see a doctor about constipation. So first up, we talked about some of the 3 key characteristics of constipation, and that includes fewer than 3 bowel movements per week, stool that is hard or difficult to pass or feels painful, and also the feeling that your bowels are not entirely empty, that you haven't passed all of your stool. So think of it as being kind of similar to a urinary tract infection, in that feeling that you still need to go, but you're not able to go. Although urinary tract infections are generally caused by bacteria, whereas constipation is normally your colon just absorbing way too much water from the excrement. Different causes, very similar feeling. So when should you go see a doctor? Well, if you have some symptoms like this that don't go away with self-care, like you drink more water, or you start moving around a little bit more, or you eat more high-fiber foods, things like that. Or if your family has a history of colon or rectal cancer, then you should go see a doctor. You should also go see a doctor ASAP if you have constipation and any of these symptoms I'm going to list. Lower back pain, if you're losing weight without trying to, if you have, of course, the big ones, fever, vomiting, blood in your stool, constant pain in your abdomen, bleeding from your rectum, or inability to pass gas. Remember, if you go and have certain surgeries, before they will release you, they will make sure that you're able to pass gas first. And that's because if you're unable to pass gas, it is usually due to an underlying problem like an abdominal obstruction. So if you have an intestinal blockage, that can be a very serious condition, and that can be whether it's a total or a partial blockage in your small or large intestine. So the inability to pass gas isn't really a disorder in and of itself, but it's normally a symptom of another underlying condition that needs to be diagnosed. Of course, that bowel obstruction may be down to plain old constipation. So it's just to be on the safe side to go and see your doctor about that. Now, constipation itself may be a side effect of other issues. So remember earlier we mentioned those calcium channel blockers, and they say that those can cause constipation. Well, some of the other things that were on that list we just mentioned of fellow symptoms that tell you should go to the doctor also are associated with calcium channel blockers, and that can include headache, nausea, fatigue, things like that. So if you have constipation, it could be a disorder in and of itself that can be easily fixed by those changes in lifestyle, like your diet and stuff, or a change in medication, or it may be indicative of something else. So it's good to go to the doctor if you have any other symptoms or if you have questions about that. But remember, if you think that your calcium channel blockers are giving you the constipation, headaches, and nausea, you can also talk to a pharmacist about it. Pharmacists aren't just people who hand us over our drugs over the counter. Remember, they go to school for that. Doctors aren't experts in drugs. Doctors are meant to be experts in the human body and figuring out what exactly is wrong with you. They're troubleshooters. They're diagnosticians for your body. And then they look at it and they go, okay, this drug treats that. Going to go ahead and prescribe that. But pharmacists are the actual experts in your medications. So if you have a question about the medication, go talk to your pharmacist. If you have a question about the disorder, talk to your doctor. You can still also talk to your doctor about that medication, especially if they're a general practitioner. They probably are treating the same several things over and over again, mostly strep throat, things like that. And you get firsthand experience with it. You know it when you see it, and you know which antibiotics go with that one. So I'm not saying that doctors don't know about meds. I'm just saying that you don't necessarily have to spend that money to go to a doctor if your question is specifically about the medication. You might go ahead and talk to your pharmacist first, or talk to your pharmacist as a second opinion. I'm a big fan of info gathering, so I'm going to ask both probably. Keep in mind that if you also change your medication, that can result in constipation. So talk to your doctor about it. It may be that that's just an initial side effect that will fade with time. I know that for Prozac, there are a bunch of different side effects that are temporary, like not being able to sleep. Anytime I up my medication, and this is also true for some of my other friends who are also on Prozac, anytime we go up a gradual dosage, then we have trouble sleeping. So it just kind of gives us insomnia, can't fall asleep, can't stay asleep. But by taking that medicine at a different time, then that can also ease it a little bit. And after a couple of weeks of being on it, then it goes ahead and levels back out again at that new dosage, and then I can sleep just fine. But whenever I have a change in that medicine, then it can go a little bit sideways for me a little bit with my sleep. I've experienced similar things in my personal life with birth control. So different levels of those hormones make me react differently. Of course, our bodies are very sensitive to hormones. So whenever I have changed those in the past and I've gone from one that has a low amount of estrogen in it to one that has a higher amount, you're gonna cry a little bit, or you're going to have inappropriate outbursts of laughter. It's just gonna mess with your hormones quite a bit, and that is to be expected. Although those, in my experience and according to my doctors, can take about 3 months to level out. So with Prozac, normally that levels out for me within about 2 weeks in my personal experience. But with birth control pills, if you're changing those, or if you have been off of them for a while and are going on them, or you haven't been on them for a while, then that can also make the symptoms last a little bit longer, or they'll seem a little bit more pronounced. That's just your body accommodating to the different amounts of hormones in there. And that's just like accommodating to any medicine, whether that be Prozac or whether it be medicine that results in constipation. Sometimes those side effects are temporary. So it's always worth talking to your doctor or your pharmacist about that to see if there's something you can do to help prevent it, and also if there's something that you can do to treat it, or really tell you when you can expect that hardship to go away. Interestingly, if you use too many laxatives, that can also result in you getting constipated. You might also feel sluggish, you might have some abdominal pain, or feel bloated or uncomfortable. And if you have any of these extra symptoms that make you go, hey, maybe I should go see a doctor, or, I've had a med change and this hasn't gone away, maybe I should go see my doctor about it, then do. Follow your gut instinct on that. But it was a gut joke, a GI joke. I couldn't help myself. But the constipation, it will be diagnosed by your doctor depending on some tests. So they're going to ask you about the duration of your constipation or the severity of it. Fully expect them to ask you how many bowel movements you have per day or per week, when the constipation started, how long it's been, things like that. So you might want to keep a little diary of that. Now, yes, I am effectively saying you should be keeping a poop diary. And there's nothing wrong with that. That is your body going, hey, there's something wrong and I need you to pay attention. That's your body telling you, hey, take some notes on this. This might be important. And that's okay. So go ahead and write it down. You can also get little books on the internet that are already made for this. And I've bought these for my friends in the past. So they have I think it's called the Poop Journal or the Poop Book. And it will have a little section on there for you for many days. They're prompts, really. And it'll ask you about the consistency and the shape and things like that. How difficult it was to pass, what color roughly it was. And it will give you a Likert scale for it. So on a scale of 1 to 10, 1 being diarrhea and 5 being just soft, easy to pass stool, and 10 being hard and dry, what was the consistency of your stool? Things like that. And that can be very helpful for your doctor too. So you don't necessarily need to go that in depth in keeping track of it, but those books are very useful, and they also have a little a hair bow thing on the end of them, a piece of elastic that can go around your doorknob if you'd like. So you can keep that poop book in the bathroom where it's most relevant, honestly. So there are options, is what I'm saying. Whether you're one of those people who likes very clean data that is standardized, or if you're just I can just write this down real quick, I can just jot it down, it'll be fine. Or maybe you are a superhuman and you can keep it all up in your noggin all the time. If you are one of those last people, please let me know your secrets to memorizing everything and not having to write stuff down. I would love to hear it. Now, once you get to the doctor, they're also going to talk about your age, whether you have blood in your stool, if you've had any recent changes in your bowel habits, or weight loss. So those changes in your bowel habits are where those poop books come in handy, because a lot of times we don't pay that much attention to it. but they may also run some tests. So they'll ask you for your medical history. They'll also maybe perform a physical exam. So they might do a digital rectal examination, and that is the one where they insert a gloved, lubricated finger into your rectum to check out your muscle tone that closes off the anus. So that's what they're checking when they go to do a rectal exam. And that's to help see if there's tenderness in there, or if there's a bowel obstruction or blood. That can also tell them about how much stool you have, what the consistency is like, and if you have any enlargement of your rectum. So they're checking for several different things when they do that. They're also possibly going to do some diagnostic tests, like an abdominal x-ray, or they might do a lower GI series. So that is called a barium enema. So they're going to give you this fluid that's kind of chalky and metallic tasting. It's a chemical and it's a liquid, and you'll receive that via an enema. And then it will coat the inside of your organs to help them pop up better on x-rays. Now, I did also say that it tastes metallic, and you might be thinking, Alex, why would somebody drink something that is meant to be an enema? It's okay, don't freak out. So if you are having a lower GI series, you're wanting to see the large intestine, the rectum, and the lower part of your small intestine, then you get a barium enema. If you're wanting to look at the upper GI tract, then you usually drink that to illuminate it. You're not going to usually do a barium enema to look at the upper part of the small intestine. So for the upper GI tract, you're going to drink the barium. And for the lower GI tract, you get a barium enema for that. Interestingly, something that they don't really tell you about that, but is perhaps they should because it can be a little shocking, is it can make your excrement look white. Yes, I mean like bird poop. It makes it look white. That's just because of how barium is. One of my friends has had these barium drinks and it made her stool look white, and she went to the bathroom and freaked out at first because she had forgotten about the barium, and no one had warned her that it might turn it white. So it's like scaring people by having them eat that old blueberry cereal that turned your excrement blue, or if you have that Superman ice cream where it's pink and yellow and blue, and it really tastes like vanilla pretty much, but it's all highly pigmented, and you forget you ate that, and then later you go to the bathroom and your excrement is green, and you're like, why does this look like a crayon? Well, that's because sometimes our diets, the things we put in our body, can do weird things to our excrement. It's easier to tell when something looks a crazy color, but also texture matters. So your doctor is going to see what exactly is going on inside of your GI tract by having you take that barium to help it pop up and really be noticeable. When they do the x-ray of your abdomen, if they see little narrowed areas, those are called strictures. They are looking for blockages, obstructions, and also other problems. And that will help them go, hey, that might be what's causing this problem. If you're having a narrow area, it's going to take things longer to pass through. It's going to take that indigestible material that is being turned into excrement longer to pass through. And therefore, you may also be absorbing too much water from it, and it can be causing you constipation. They may also do a colonoscopy. That will help them figure out if you have any weird growths in there, if you have tissue that's inflamed, any ulcers or bleeding, and they just put a lighted scope up your rectum and check everything out in your colon. It goes in through the rectum and all the way up into the colon, and it lets the doctor see the lining of your colon. And if they have to remove some tissue for further examination, they can do that without having to open you up. So they can take a little bit of that tissue and then go and run some tests on it to see if there might be some problems that we didn't know about without being able to look in there or to run those tests. They may also do a sigmoidoscopy. So that is helpful in identifying not just constipation problems or causes, but also diarrhea, abdominal pain, abnormal growths, or even bleeding. And in that case, they will put in another short, flexible lighted tube called a sigmoid scope into your intestine through the rectum. So the colonoscopy scope is long and flexible. The sigmoid one is short. And they take that scope up in there, and then it also blows air in the intestine to inflate it, and that makes viewing that inside easier. So they're a little bit different in principle, but overall, they are looking in your large intestine to see what's up and what is causing this constipation. They may also do a colorectal transit study. And that is just a fancy way of saying they're going to see how well food is moving through your colon and your rectum, your colorectal area. So they'll have you swallow capsules that have these little tiny markers that allow your x-rays to be more visible again. It's very similar in principle to the barium enema or drinking barium if you are having to get your upper GI tract checked out. So then you also follow a high fiber diet during the course of this test, and then they follow the movement of those little markers in those pills through your colon via abdominal x-rays that they take several times about 3 to 7 days after the capsule is swallowed. So they just are essentially tracking your digestion with these little tiny markers inside of these capsules. It's pretty metal and pretty cool that we can do that. They may also do an anorectal function test. So that test is meant to diagnose constipation caused by any abnormal functioning of either your anus or your rectum. So anorectal. Now, depending on the results of your test and how difficult your constipation is, like its duration and its severity, and how tolerant your body is of specific medications, or what your threshold is personally for procedures or therapies, and also your preferences. They matter. Remember, your doctor is your partner in figuring this out. But depending on all of that, and also the expectations for your prognosis, the course of your condition, then your doctor might offer you different specific treatment plans. We're going to go on a quick break, and when we come back, we are going to talk about some of these medical treatment plans and some of the natural ways that you can also try to combat and resolve constipation. Stay tuned.
The GSMC Life and Happiness podcast takes you on a journey of exploration. We'll discuss tried and true methods alongside the latest trends of how to best live your life to its fullest and happiest. From psychology to meditation, science to self-help books, the GSMC Life and Happiness podcast will help you to discover what makes you happy and how you can live life being the best you possible. Download the GSMC Life and Happiness podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Before the break, we were talking about what to expect if you go to the doctor for constipation, including some of the tests they may run, questions they may ask, and what a sigmoidoscopy is. So now that we know what these procedures may be and what to expect, we're going to talk about some of the treatment options. Now, some of these are medical and some of these are totally natural. I'm going to give you guys a solid mix of them so that you can decide what you would like to try, and either if it's something you can do at home, that you can do at home on your own, or something you can talk to your doctor about. First up, your doctor may prescribe a modification to your diet. So specifically, you're looking to have 20 to 35 grams of dietary fiber per day to help you form soft, bulky stool that is easily passed. They want you to add foods like beans, whole grains, bran cereals. I know, gross, bran cereal, but you might end up liking it. I don't know. You haven't tried it yet. I know it sounds like something that our grandparents eat, but again, that's probably because it's good for you and it's good for your colon. So maybe try bran cereal. You might also add more fresh fruit or fresh vegetables into your diet to get some fiber in there. Remember that fiber is also good for helping regulate your blood sugar. So remember your insulin and everything. It's really important to have fiber in your diet to absorb all the nutrients that you need and to slow down that digestion too, to make sure digestion goes smoothly, goes the way it should be. So if you're drinking a ton of juice, have some of that whole fresh fruit. Don't just reach for juice to resolve this. Getting more fluids, great idea, but we also want that fiber that comes with the fleshed fruit. So that fiber is stripped out when we have juice. So we want to make sure that we're getting that whole fruit. You also might be recommended to limit some foods like ice cream, cheeses, anything that has a lot of lactose in it. Also certain meats and processed foods, especially the type that contain little to no fiber. If your doctor has prescribed some of these diet and lifestyle changes and they still haven't worked, they may prescribe laxatives unless overuse of laxatives is what caused it to begin with. And they also may eliminate or change your meds. There's also a really cool therapy we've talked about in the past called biofeedback therapy, which can be used to treat a ton of different things in your body, but specifically for chronic constipation, you can use biofeedback therapy if that is caused by anorectal dysfunction. So biofeedback therapy in this case helps to retrain those muscles in your body that control the release of your bowel movements. So those muscles we talked about in the first segment today. You can also try to drink more water. Being dehydrated regularly can definitely make a person constipated, so you want to stay hydrated. Remember that by the time you feel thirsty, you are already dehydrated, so you want to pre-hydrate. When you're constipated, you might feel a little bit better if you have some carbonated water. So that sparkling water, that Perrier or Topo Chico or any of the other brands of sparkling or carbonated water might help you out a little bit. And it can also help you rehydrate and get your excrement moving along that colorectal tract again. Now, they've performed studies on this and found sparkling water to be more effective than tap water at relieving constipation in some studies. And that included people who experience indigestion or dyspepsia, as well as people with chronic idiopathic constipation. So when we say idiopathic, what that means is they don't know what the cause is for it. So they've exhausted all the avenues. They go through and they're like, okay, we have checked your diet and your intake of these things. That's not causing it. It's not an underlying health condition. It's not medication that's causing it. We don't know what it is, but for whatever reason, you have chronic constipation. So chronic idiopathic constipation just means chronic constipation with an unknown cause. So they found that even in those cases, that drinking sparkling water is more effective than tap water at relieving constipation. So maybe try that out. Try some sparkling water. But don't go for soda. So we do specifically mean sparkling water, not just any old carbonation will do. So carbonated beverages that have a lot of sugar in them, like soda, can have harmful health effects, and they can actually make constipation worse. So make sure you're going for carbonated water and not just stopping when you hear carbonation. Some people with IBS, though, find that carbonated drinks actually make their symptoms worse. So if you have IBS and you get constipated, you might want to avoid sparkling water and anything else that's carbonated. That includes sodas and, sadly, also beers. So the TLDR of this is that dehydration can cause constipation. So make sure you drink enough. If you don't like water, you might want to try sparkling water. And it turns out that that might even be more effective at helping you out with your constipation. Of course, we also want to eat more fiber. I feel like drinking water and eating more fiber is the go-to for everyone who has ever experienced constipation or has had a child who has constipation. That's just what you do. You go, okay, yes, water, fiber. Much like if you have somebody experiencing a headache and you go, okay, have you drank enough water today? Have you eaten something? And is your ponytail too tight? Things like that. You go down the list for certain things. So I feel like number 1 and number 2 on this list are gimmies. But remember, when you're looking for fiber, you especially want soluble, non-fermentable fiber. The reason we want this kind is that getting that fiber intake up and everything makes more of a bulk for your excrement, and it also helps with the consistency of it. It makes them easier to pass. It also helps them pass through the digestive system more quickly. It kind of, makes a hole. It plows the way ahead for you and just makes it a little bit easier. It's doing most of the work rather than, having your intestines have to work super hard or really long hours to get that material all the way down to the rectal area. In 2016, a review study found that 77% of people with chronic constipation benefited from fiber supplements, supplementing with fiber. So eating more fiber, not necessarily taking fiber pills. So some studies have also found that increasing fiber intake can make the problem worse. So it really just depends on the actual underlying cause and your individual body. Other people report that the dietary fiber improved how frequently they went to the bathroom, but it didn't necessarily help with other symptoms of their constipation, like the consistency of their stool or the pain they get in their abdomen or the bloating or gas issues. But that's also because different types of dietary fiber have different effects on digestion. So you want to do the soluble kind that is non-fermentable, and that should give you the best outcome. Your doctor may also recommend lifestyle changes like exercising more. A lot of studies have linked sedentary lifestyles to an increased risk of constipation. But not all studies necessarily agree that exercise treats constipation. They are still researching that. But hey, exercise is generally free, and they mean just gentle exercise like going for regular walks or even jogging, swimming, cycling, and seeing if that helps. It may or may not work for you, but at least that's something that you'll know going forward. When your doctor says, hey, you should try this, and you say, hey, I already did that, and that one didn't work for me. What else can we try? You can also drink coffee, especially the caffeinated kind. So for some folks, consuming coffee increases your urge to go to the bathroom. And that's because coffee stimulates the muscles in your digestive tract. There was a study in '98 that found that caffeinated coffee can stimulate your gut in the same way that meals do. And the effect was 60% stronger than just drinking water and 23% stronger than drinking decaf coffee. So, go ahead and maybe treat yourself to a coffee. You can also take herbal laxatives like senna. So that one's a really popular herbal laxative that is deemed to be safe and effective overall. And you can get it over the counter and online in either the oral or the rectal form. And the way it works is it has these little plant compounds called glycosides in them. And those really make the nerves in your gut sit up and listen. And it helps speed up your bowel movements. Now, doctors will say senna is safe for adults for short periods of time. But talk to your doctor if your symptoms don't go away after a few days. Don't just keep taking the senna. Don't take it if you're pregnant or breastfeeding. Don't give it to kids. And if you have certain health conditions, it's contraindicated. So if you have IBS, things like that, don't take senna. If you're thinking about trying it, you might want to run it by your doctor. You can also eat probiotic foods or take probiotic supplements. Remember that most of the good bacteria in your body is located in your lower intestine. So it's located at the end of your large intestine in that rectal area. So you might need to have more probiotics in your food. A 2019 review study found that folks who took probiotics for 2 weeks could get better help with their constipation, and it increased both their stool frequency and consistency. So you can get probiotics online or at the store, and also, as always, I'm going to say it's better to get it through your food. And you can do that with foods like yogurt, which I hate, but also kimchi or sauerkraut, which I love. So you have a lot of different options for this. And if you hate yogurt and things like that, then you might be able to find an alternative. So you can try prebiotic and probiotic foods, and we have a few episodes about those types of supplements in our GSMC Health and Wellness episode vault. So check those out if you're looking for more information on how prebiotics and probiotics work and different ways that you can use to incorporate them into your life. Remember, you don't want to just be trying to shovel something in your mouth that you hate. We can find something that our bodies enjoy, and that thereby makes it more likely that we will follow along with this more healthy plan. You can also get over-the-counter or prescription laxatives, and there are different types, actually. I didn't know that before I did the research for this, but you can get some that are fiber-based that help increase the water content of your stool. So those bulking agents, by making the stools bulkier, it can also increase the retention of the water. You can get stool softeners. You can also get stimulant laxatives, so those are stimulating those gut nerves. And then you can try osmotic laxatives, and those pull water from the other tissues into your digestive system. So you don't want to take these on a regular basis, especially without consulting a doctor, but they may be able to prescribe a specific kind for you to address your specific bodily needs. If you specifically have IBS-related chronic constipation, then they may put you on something called a FODMAP diet. So FODMAP. Now, the low FODMAP diet is an elimination diet. So it's supposed to help treat your IBS and also relieve some of the constipation that's associated with IBS. So FODMAP is a very large expanded acronym, and it is called fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. So the TLDR of that is that those are sugars or sugar replacements. So artificial sugars are also bad for you and can be causing this constipation or be associated with this constipation that's related to IBS. So it's just eliminating a lot of these things from your diet, these carbs, and to have them out of your system for a period of time before reintroducing them in one at a time. And that helps you see which ones are really hurting your body and which ones your body's tolerant of. So if you have constipation predominant IBS, just doing the low FODMAP diet's not going to be enough typically, and you might have to also get more water and fiber to get that full relief from your symptoms. So the TLDR of this is that you really might be able to try one of these and it work for you. Or you may try a combination of these or cycle through a bunch of different ones until you find what does work for you. But that's okay. There are lots of free options out there, and they range from prebiotics and probiotics to taking magnesium citrate, which is an over-the-counter supplement, so you can get that OTC. You can also try eating prunes or avoiding dairy. You can restrict things from your diet. You can add things to your diet. It really just depends on your specific causes of your constipation and your symptoms and your individual body as to how your body will react to each of these. So it might take a little bit of trial and error, but if you're trying to improve your digestion in general, they recommend getting whole grains, leafy greens, as well as lean protein, and also low fructose foods and avocados. So those low fructose fruits can help you reduce gas or bloating. So if you have that associated with your IBS or with your constipation, then you might want to eliminate foods like apples, pears, and mangoes because those are high in fructose. So they would be part of that low FODMAP diet where they would say, hey, you might want to eliminate these fruits. This is too high in sugar. We don't want that. But berries and citrus fruits are a lot better for you. They have less fructose, so that makes them easier for your body to process, and they're less likely to cause gas. Bananas are also like that. Bananas are the perfect snack food too. It comes in its own casing, you guys. Now, I hate them, and I will not eat them. I'm not even in banana bread, but that just means that for me, I would be eating more of these berries and the citrus fruits and lean proteins and avocados. I love avocados. The only thing about avocados is that they are dense in fat, so you have to eat them in moderation. You don't want to have too much avocado. So I like to add it on top of burgers and on top of anything really that I eat. It's good with fish. It's good with salads. You can put avocado on just about anything. I like to eat it on the side with eggs in the morning. So you can make your avocado toast and eat it too, and it can be really great for your constipation. You have those whole grains and that avocado on top of it. I also like to chop up some strawberries and then put a little bit of cayenne pepper on it. If you're sensitive to cheese and it is causing your issue, maybe don't do what I do and put blue cheese on that too. But if you're able to tolerate that, I highly recommend that. It sounds a little bit crazy to put, avocado and strawberries and blue cheese and cayenne pepper perhaps on top of some whole wheat toast. But I'm telling you guys, it is Flavor Town and you should definitely try it out. All right, that's all I have for you today. I hope that you guys have learned a lot about our gut health and wellness with me today, including ways to relieve constipation and how to know when to go to your doctor about it. I love having these difficult conversations with you guys because, there's no reason for this to be a taboo if everybody poops. Thank you for listening to the GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'd like to ask that you please subscribe to the show, and writing a nice review always really helps us. Also, if you could please follow us on Facebook, Twitter, and Instagram, I'd appreciate it. Thank you kindly, and have a good night.
You've been listening to the Golden State Media Concepts Health and Wellness Podcast, part of the Golden State Media Concepts Podcast Network. You can find this show and others like it at www.gsmcpodcast.com. Download our podcast on iTunes, Stitcher, SoundCloud, and Google Play. Just type in GSMC to find all the shows from the Golden State Media Concepts Podcast Network, from movies to music, from sports to entertainment, and even weird news. You can also follow us on Twitter and on Facebook. Thank you, and we hope you have enjoyed today's program.